Mr. Chairman,
Sergeant at Arms,
the Honorable Tom Udall, United States Senator from New Mexico.
Very well. Let's welcome Senator Udall to the House chambers. Senator, we welcome you to the House chambers. Great to have you here. We look forward to hearing from you. Good to see you.
Mr. Lieutenant Governor, thank you, and thank you to my escort that showed me in here today. Thank you for the good, the warm feelings. Mr. Speaker, President Pro Tem Papin, Majority Leader Worth, it's a real pleasure to be here with you today. Distinguished members of the New Mexico Legislature, tribal leaders, and honored guests. Let me just say that it's always an honor to appear before you, and I really, really appreciate your invitation. I heard as I was sitting in the Speaker's office, kind of reading through my speech and trying to get ready for this occasion, that Representative Jim Trujillo had heart surgery and a heart situation. Obviously, my heart goes out to him and his family, and my thoughts and prayers. And I would just ask all of you that see him to give him a big hug for me and tell him we wish him the very, very best. And I shook hands with Stuart. I don't know whether all of you saw it, but I mean, I can't imagine, you know, we're two standing here still after 30 years or so, right, Stuart? Oh yeah, don't tell anybody. He's just, shh, don't tell anybody. But anyway, as you know, I'm honored to be here on Immigrant Day of Action. I was down in the rotunda with Mo Maestas, with State Senator Richard Martinez, with Bill McCambly, and several others I think that have been throughout the day. So it's just great that we have so many supporters of immigrant rights today in the gallery. And I salute all of you in the gallery that are here, the immigrant rights. Thank you for your hard work on behalf of immigrant communities, and especially in these really tough times. As New Mexicans, we know that immigrants contribute to our communities in all kinds of ways. They make us stronger, bringing us new ideas, new energy, new enthusiasm for our country and for all it stands for. Our president has leveled an unfair and divisive attack at immigrants, and I fear his rhetoric will breed more hate and more fear. We must stand up against it. We need comprehensive immigration reform, not more walls. We must welcome dreamers and their families, not deport them to a country they have never known. And we need real border security that will protect our communities and property, but will facilitate business and good relations. And we should protect the rights of communities like Santa Fe and others in New Mexico to determine their own laws and protect their own citizens, not punish them for telling the federal government to do its job. As you all know, the federal government's job is to enforce immigration laws and to protect the border. We are a nation that welcomes newcomers. Immigrants from around the world come here because we offer hope and opportunity. Our democracy is an example for nations around the world, nations that value civil liberties, freedom, and human rights. That is why the actions by President Trump in his first 2 weeks are so unsettling, so chilling. I strongly condemn the President's executive order banning immigration from 7 Muslim-majority countries. This ban cuts against America's deepest held values. It cuts against freedom of religion and the very foundation of our country. It cuts against America's long history of opening its shores to immigrants and our long history of giving refuge to victims of raging wars and natural disasters. And nobody knows it better than our great state of New Mexico. The President's ban targets refugees fleeing wars fought by armies that our government is assisting. And it does nothing to make us safer. It puts us in greater danger. It fuels anti-American sentiment across the globe, giving terrorists the propaganda they need to claim the U.S. is not fighting for freedom, but it is at war with the Muslim world. Silence gives license to injustice. History has taught us this lesson over and over again. Each of us should openly and forcefully denounce the President's Muslim ban. Standing together, we can defeat this injustice. I would like to focus the rest of my remarks today on the Affordable Care Act and what the congressional repeal could mean to New Mexico, for the health of New Mexico's families, and for New Mexico's fiscal health, which all of you here are right in the middle of, trying to get our fiscal health and fiscal house in order. Right out of the gate, the Republicans in the Congress and the President began repeal of the Affordable Care Act. But they didn't put forth an alternative plan to make sure that people keep the health care they have. They still haven't. The threat of repeal with no replacement has created enormous uncertainty for Americans in the marketplace and in state legislatures. My office has received hundreds of calls and emails from New Mexicans who are scared, and really scared, they will lose their health care. They are frightened that they need medical care, that their need for medical care will be taken, their medical care will be taken away from them, from their children, and from their elderly parents. Now, I'm not going to stand here and tell you that the Affordable Care Act is perfect, and it's not. But it has helped millions of Americans and hundreds and thousands of New Mexicans. And we should work. And we should work on a bipartisan basis to improve it, not throw it in the garbage and risk millions of people's health and hurt the economy in New Mexico and throughout the country. Americans don't want to go back to the days when the insurance companies could deny health insurance based on a pre-existing condition. They don't want to go back to when insurance companies could cancel health insurance based on arbitrary lifetime benefit limits. The American people want coverage for their young children, and Americans support free preventive care services. These are all signature provisions of the Affordable Care Act. Before the ACA, New Mexico had one of the highest rates of uninsured in the country. 19.6% of our state did not have health insurance, almost 1 in 5. Since the ACA, New Mexico's uninsured rate has dropped dramatically to 8.9%, more than a 50% decrease. The ACA has made sure 300,000 New Mexicans have health care insurance. 300,000 that didn't have it before in 6 short years. That's a big step forward. But you know, statistics in our health care system are important, but not the thing that's really important is the people. And I want to tell you a little bit about real people's stories that are behind the statistics I've just talked about. And I'd like to share with you a few of our constituents' stories. We have a couple of them here today. There was the first gentleman, I'm going to just say a little bit about the healthcare situation, but Kevin, he saved my daughter. This was the heartbreaking plea from Kevin, an Albuquerque resident. Kevin's 33-year-old daughter, Amber, had multiple sclerosis, a tough disease, as we all know. Kevin is here with us. Kevin, could you stand? And yeah, thank you for being here. Thank you very much for being here. I'm going to tell a little bit about Kevin's story and his daughter's story. To treat her MS, Amber, his daughter's named Amber, Amber must follow an exact and rigorous drug regimen, coupled with regular visits to her neurologist and annual MRIs. The cost of her medication is $60,000 per year. Amber's doctor visits and MRIs would run into the thousands of dollars. Despite her MS, Amber has a job. In fact, she has a good-paying job, but her employer doesn't provide her health insurance. Yet Amber is able to get health insurance through the individual open market. She is able to obtain insurance because the Affordable Care Act no longer allows insurance companies to deny her because she has multiple sclerosis. Amber is able to work because she gets the medical care she needs. She's able to get the medical care she needs because of the Affordable Care Act. But Kevin fears his daughter will lose the right to health insurance if the ACA is repealed. He is worried she won't get the medical care she needs to remain healthy, to lead a normal life, to work, to contribute to society, and to stay off public assistance and to survive. This one ACA provision, prohibiting discrimination based on pre-existing illness, protects an estimated 861,000 New Mexicans and an estimated 134 million Americans. It's a safe bet that all of us here know at least one person like Amber. Think for a minute. You probably know one person like Amber who has a serious illness that would prevent them from getting health insurance, but for the ACA. So it's not surprising the vast majority of Americans, close to 70%, want to keep this protection. The Kaiser Family Foundation estimates more than 1/4 of all adults under age 65 have health problems that could make them uninsurable without the ACA. If those who want to repeal the ACA get their way, all these people will be at risk. Kevin is also scared because the costs of treating Amber's disease are so high. Without the ACA, any insurance company could cut off her health coverage if her medical expenses exceed the company's lifetime benefit limit. This ACA provision prohibiting lifetime benefit limits protects an estimated 555,000 New Mexicans and an estimated 105 million Americans. People who need medical care the most, people with serious medical problems, have most and have many of the high medical costs. If those who want to repeal have their way, care for people like Amber would be wiped away. Now, I'm a father of a daughter, and I'm angry that this father, Kevin, has to worry whether his daughter will get the medical care she needs to live a healthy and productive life. Kevin, thank you again for being here with us today so that I can tell that story and we can put a real face on it. We also have with us today, I believe, Pam and Mike. Mike and Pam, could you stand up? Thank you for being here today with us. Really appreciate it. Thank you. Pam and Mike are husband and wife from Placitas. They own a small business. They signed up for an insurance plan under the ACA as soon as they could because premiums before the ACA were too expensive and Pam had a pre-existing condition. Using their new preventive care, they found out Mike had an aggressive form of cancer. But thankfully, doctors caught the cancer early. Mike was treated at the UNM Cancer Center and it's cured. Pam says there is no question that the Affordable Care Act saved her husband's life. Because, because of the ACA, private health care plans must cover a range of free preventive services, everything from cancer screening to flu shots. Over 730,000 New Mexicans now benefit. Catching diseases early saves lives and reduces health care costs, but preventive care is expensive if you're uninsured or you're poor. And an overwhelming majority of Americans, 83%, support making preventive care free. But what will the President and the Republicans do to make sure Pam and Mike and millions of others can keep getting cancer screenings? Nothing. They have no plan. No plan. We're willing to work with them. Even President Obama going out, so we're willing to work with you, but no plan. And I want to thank you again, Pam and Mike, for being here with us to put a face on what's happening and the great progress we've made in the Affordable Care Act. Now I'm going to talk about one more of our constituents, Amy and her husband and 4 boys. I don't think they were able to be here with us today. We all know New Mexico is not a wealthy state. A lot of working families qualify for Medicaid. New Mexico wisely adopted the Medicaid expansion under the ACA. You in the legislature had a lot to do with that and helped out with that. And I thank you for that, all of you here. That Medicaid expansion allowed 82,000 more people to get health care. Before the ACA, the only place many New Mexicans got health care was the emergency room. Now those 82,000 New Mexicans have health care. Take Amy, her husband, and her 4 boys, ages 13 to 19. Amy and her husband own a family business in Santa Fe. Before the ACA, Amy and her husband went without health insurance because they couldn't afford it. They just hoped nothing catastrophic happened to them. As soon as she could, Amy applied for health insurance under the Medicaid expansion. Medicaid expansion covers herself, her husband, and her oldest son. Amy says she's grateful for that because of the ACA. Medical bills will not drain us financially. There are 8.4 million people across the country just like Amy. Like Amy, they work. They do not have high-paying jobs. They couldn't afford health insurance before the ACA. But there is no plan for them to stay on health insurance if the ACA is repealed. These hard-working Americans deserve good medical care. Americans agree, 80% favor the Medicaid expansion for low-income, uninsured adults. Now, we have 19 pueblos and 4 tribes in New Mexico. Native Americans make up more than 1/10 of our population, and you and I, all of us here, represent the Native community in one way or another. And as the vice chair of this Senate Indian Affairs Committee, I represent all of Indian country. Native Americans are eligible to receive care through the Indian Health Service, but the IHS, the Indian Health Service, is severely underfunded, and long delays are common. As a result, many tribal members rely heavily on Medicare, Medicaid, and the ACA Health Exchange. More than 132,000 tribal members are enrolled in Medicaid in New Mexico alone. The all Pueblo Council of Governors, representing all 19 pueblos, tells me that without the ACA, more tribal members will go back to the days of long delays. Many will see coverage cut. IHS hospitals are heavily dependent on third-party collections for clinical services. In fact, current federal funding covers less than half their operational costs. But fortunately, increases in revenue from Medicaid expansion have offset those costs. Bottom line, without Medicaid expansion revenue, necessary services may no longer be available throughout Indian country. This is unconscionable. I have prepared legislation that would protect the Indian Health Service, and I will fight any cuts in federal funding if the ACA is repealed. So what would the ACA repeal do to New Mexico? And this is something I think you as legislators need to really think about, and why I wanted to talk about this today, so you could speak up vis-a-vis the federal government and tell them your situation financially here and how you feel about assuming this burden. So what would ACA repeal do to New Mexico? First, the 300,000 New Mexicans who have health insurance because of the ACA would lose their health care. This includes the 82,000 New Mexicans who have health care because of Medicaid expansion. In New Mexico, approximately 26,000 more children are covered just between 2013 and 2015, largely because of the ACA and the Medicaid expansion. New Mexico now insures more than 95% of our kids. You should clap about that because you all had a lot to do with that. 95% of our kids, above the national average. These children should not lose their medical care. If the ACA is repealed, more than 861,000 New Mexicans who have a pre-existing condition can be cut off from health insurance, and those 555,000 New Mexicans who have high medical costs can be cut off also. These human costs alone should convince us that ACA repeal with no replacement makes no sense. But in addition, the ACA repeal would wreak havoc on our fragile economy here in New Mexico, and that's what you're in the middle of here. The ACA has been an economic boon for New Mexico. 7 of the 10 fastest growing job categories in our state are in healthcare. The director of the BBR recently told the Senate Finance Committee that although New Mexico's unemployment rate is second highest in the nation at 6.6%, boosts from healthcare and tourism led to positive job growth for the last 2 months. If the ACA is repealed, New Mexico could lose an estimated 19,000 jobs. 19,000. That's what NMSU economist Jim Pete said during the same Senate Finance hearing. He says ACA repeal would be, quote, devastating to the New Mexico economy. And the loss in spending in New Mexico would be astronomical. Now, I'm going to throw a lot of numbers at you, but this is important. Just listen to these. ACA repeal would mean a loss of $93 million in federal marketplace spending in 2019. And $1 billion between 2019 and 2028. It would mean a loss of $2.2 billion in federal Medicaid funding in 2019 and almost $27 billion between 2019 and 2028. The hit to our economy would be immediate, would be sustained, tax revenues would decrease. If the ACA is repealed and health care gets pushed back to the states, no state budget, I believe, is ready to take on the extra load, especially in light of those numbers and especially in light of the situation that you're in here today and that I have been talking to you about individually. We will go back to the days of no care, uncompensated care, and the use of taxpayer-subsidized ER services as a last resort. You are grappling with balancing the state's budget. New Mexico faces one of the highest unemployment rates in the country, coupled with one of the slowest job growth rates. ACA repeal is precisely the wrong prescription for New Mexico. In the end, after all the arguments about nuances of healthcare policy, the statistics, the costs, we must decide whether Americans have a right to health care. For me, there is no question. Every person should be able to see a doctor when they're sick. And that should be our nation's guiding principle. From that principle, we can debate how to get there, and of course there will be differences, but we should work through them with civility. I loved my years here as Attorney General, working with this legislature. You have retained, and in a sense, you're almost an island. You've retained solid bipartisanship and civility. You should treasure those qualities. They will take you a long way. Thank you, and really great to be here with you today. Thank you very much. Thank you. Thank you.